COVID-19 cases in schools are peaking across Maine, forcing district staff to make tough choices on how to go forward with what's left of their fall semesters. Good evening, everyone. I'm Chris Costa. Amanda Hill is off tonight. In the last 2 weeks, more than 1,400 kids ages 12 and younger have tested positive for the virus in Maine. That makes up more than 20%, or 1 in 5, of all of the new cases in Maine in the last 2 weeks. The latest data from the Maine Department of Education says 161 schools have outbreaks as of last Thursday. Lewiston Middle School is one of those schools where cases are causing problems. The superintendent says the middle school is going to remote learning on Friday because, quote, the district simply does not have enough staff needed to stay open. He says that's due to a rise in cases in kids and staff testing positive for the virus and having to isolate or quarantine. It is a similar case in Winthrop. The school committee there voted to take the entire week of Thanksgiving off from classes and keep staff and students out of buildings to hopefully let case numbers subside. They plan to tack on those missed days, the Monday and Tuesday, to the end of the school year.
We do masking, we do distancing, we have assigned seats, we have everything that's been suggested as a recommendation by the CDC, we're doing. And this virus is spreading anyways.
The Maine CDC says it takes all of those layers and more to keep kids and teachers in the classroom. The state also wants schools and parents to sign on for pooled testing. Plus, kids and staff who are fully vaccinated for COVID-19 do not have to quarantine if they are a close contact of someone who tests positive for the virus. In the 1 week since kids ages 5 to 11 became eligible to get the shot, more than 3,000 of those children have gotten it. Maine CDC Director Dr. Nirav Shah and Maine DHHS Commissioner Jean Lambrou say school leaders, teachers, staff, and parents need to take action.
We think the tools are there to protect in-person learning, but it does require that people take advantage of these options. It does require individual action as well as action by school leadership.
The best way to prevent that happening is to ensure that vaccination rates are as high as possible. Things like vaccination, pooled testing are ways to keep at least the children in the classroom. And then, of course, the more staff who are vaccinated just statistically lessens the likelihood that schools will have to close because so many staff might be out because they got COVID.
Now, despite the research and endorsement from medical professionals and experts, there's still a lot of misinformation about the COVID-19 vaccines. Remember the myths that the shot would make you magnetic or change your DNA? Those are both false. One claim that's popped up recently is about graphene-like structures in the shot. Let's verify. We got this question from Anne in Waterboro.
How true is the article written by Dr. Carrie Madej in reference to the graphene-like structures or unknown sticky fatty substance in the vaccinations? And if they are in there, what are they?
She's talking about this. Dr. Madej says she looked at the vaccines under a microscope and claims she saw a number of things, including graphene oxide. What is graphene oxide? It's a material made by oxidizing graphite, like what you use in mechanical pencils. So we're verifying, do the COVID-19 vaccines contain any graphene oxide? Why are we verifying this? Because Dr. Madej has more than 90,000 followers on Twitter and more than 42,000 followers on Instagram. Our sources are Maine General Health's Chief Medical Officer, Dr. Steve Diaz, Northern Light Health, the Maine CDC, the U.S. CDC, and the vaccine makers, Pfizer, Moderna, and Johnson & Johnson. A Maine CDC spokesperson called the claim false and ridiculous. Northern Lights' Dr. James Jarvis called it so far out there.
This has not been verified. It's not a peer-reviewed journal. There is no substance here of accountability to the person who's published this.
The U.S. CDC publishes the ingredients inside the vaccines direct from the vaccine makers. Graphene oxide is not listed. Dr. Madej has also claimed to have found other things in the vaccines that are harmful, but all our sources say these claims are not true. And Facebook even flagged her post as misinformation about the vaccine. So we can verify, no, the COVID-19 vaccines do not contain any graphene oxide or other harmful materials.